Hello.
Hello.
Why don't you go ahead and introduce yourself, and then go ahead and talk to us a little bit about some of the symptoms you were dealing with before you became a patient at Perkins Family Wellness.
Okay. My name is Loraine. I started having a blocked ear about 2 years ago or so, and it got progressively worse. I have a lot of hearing loss in that ear now, and as part of the process of getting worse, I was experiencing bad days of vertigo and nausea. And when I say bad days, I mostly wake up with the room spinning, and that would last for an hour or two, but more than that, then I needed to sleep for several hours after that to really feel myself. So that was all bad enough. But then in between bad episodes, and those were happening every 2 to 3 months, in between that, just my day-to-day steadiness was gone. I would just find myself walking down the hall at work and go to turn into another room or another hallway, and just the motion of turning would cause me to stop and have to catch my balance. I'd have to stop and lean against the wall for a minute, and then I was fine, but it just was getting scary because I didn't think I should be driving, and sometimes when I would make a sharp turn driving, I'd even have a moment of wooziness, and it was getting really bad. I hit the low point in April of last year, and I was just desperate. I knew something had to be done. I couldn't go on like this. So I had read something on Facebook about perhaps an upper cervical chiropractor could help me, and somebody from somewhere else in the United States posted a link, and I was lucky enough to find Perkins Family Wellness, and I called and got in to see Dr. Perkins in May, and I've been seeing you ever since.
Mm-hmm. So you've been under care roughly 6 months.
Roughly 6 months now.
Mm-hmm. And I think initially when you came in, we talked about Meniere's disease.
Yes.
And some of the vertigo issues you were dealing with and balance problems. Why don't you share with everyone some of the results that you've seen over the last 6 months?
It's amazing how much better I feel now than I did back in April and May of 2016. So what I see now is my day-to-day steadiness is so much stronger. And people don't realize how important that is, but you kind of gave me, I tell you all the time, you gave me my life back. And I think that's important because I'm not afraid to drive anymore. I don't find myself unsteady when I'm walking down the hall at work. And so I think that's all fantastic, and it's worth every penny that it costs, and it's worth the time coming, because if it gives you your life back, then that's priceless. Mm-hmm. I still have had a few bad days, thanks to Meniere's, but the time frame between bad episodes has gotten longer, and my episodes aren't as severe. Mm-hmm. I had one back in mid-December, and I woke up dizzy, but I think the dizziness probably lasted about 20 minutes, and I wasn't as tired throughout the day, and I never got nauseous. That's great. So I really feel like if we can just continue to spread the span out of my bad episodes, mm-hmm. and it's all good. Yeah. Unfortunately, I still have hearing loss in that ear. I'm hoping that one of these days, maybe one of these years, after being treated, maybe I'll get a little bit of the hearing back. That would be great, because it's sad that people whisper in that ear, and I have no idea what they're talking about. But
so what would you say to someone who is contemplating getting under upper cervical care themselves?
If someone is watching this video and you have Meniere's disease and you have any of these symptoms, I strongly, strongly encourage you to give this process a try. I'm so happy that I stumbled upon this, because it wasn't well known amongst my circle of friends, and now I tell everybody to try this. There's a chart here in Dr. Perkins' office about all the things that upper cervical care can potentially help, and Meniere's is just one of many, many things, but I would strongly encourage you to give it a try, because it's been fantastic for me.
Terrific. Thank you very much.
Okay.